Hi and welcome. It's 3 o'clock here on the East Coast and I'm Laura Castricone, and this is our monthly webinar for health products for you. This webinar is being recorded, so if you are unable to join us live, please tune into our YouTube channel so you can watch it at your leisure. At the end of this presentation, there will be an opportunity for you to ask questions if you have any. And as always, if you have any suggestions for topics for future webinars, or if you want to reach me directly, my email address is laura@hpfy.com. So today we're going to talk about not just what sleep apnea is, but what the real problem about sleep apnea going untreated is. And it's not just about the snoring. So one of the real problems with, and this is one of the major ones, is obesity. So it's what we call a comorbidity of OSA. In other words, if you have obstructive sleep apnea, normally you are overweight. You can be as much as morbidly obese, which is considered 100 pounds or more overweight. And I've seen people anywhere in between. So what happens when you put on weight is you also put on extra tissue in your neck and in your torso. And when you lie flat, that gets compressed as well. And it also does not allow you to make good chest excursions when you breathe, to flush out the carbon dioxide that is left as the byproduct of breathing. So about 70% of obstructive sleep apnea patients are obese, which means that they're over their ideal body weight. BMIs of greater than like 27 or 28 to 30. We have people, I have seen people with BMIs of 50. You know, they may be 600 pounds, 500 pounds. So, and one of the big factors that I'm seeing with a lot of my friends who are working in acute care is with the onset of COVID, if you are obese or you have underlying OSA, you might be in more danger than someone who doesn't. So we talked about crowding in the neck area, and we also get what's called hypoventilation. In other words, you can't breathe deeply enough with your diaphragm to flush out the carbon dioxide that stays in your bloodstream as a result of breathing. And what can happen over the course of time is, from not breathing deep enough, is you start to build up some carbon dioxide in your system, and that can affect you in very negative ways. One of the other big issues, and this is the secondary issue that we see as a comorbidity, is hypertension and cardiovascular issues. So obstructive sleep apnea is recognized as a secondary cause of hypertension. And I've seen people with hypertension, they have no idea when they got it, how they got it. Nobody else in the family has it. And a lot of it has to do with their underlying sleep apnea. So what happens when you fall asleep at night and your airway closes off, the body starts pumping extra blood to the brain and the heart to keep them alive. And that increases the pressure in your artery walls, which in turn causes hypertension. A lot of patients that we see that have untreated obstructive sleep apnea also have what we call refractory hypertension, which means that they have tried 3 or more drugs to try to treat their hypertension to get the numbers down, and none of those have worked well. If someone has refractory hypertension, one of the first things we think of is untreated obstructive sleep apnea. So if you have hypertension or high blood pressure and you've tried different medications and it doesn't seem to be helping, you might want to talk to your doctor about getting tested for obstructive sleep apnea. Also during apneas, your heart works harder to get oxygen to your tissues, and your airways closed off. So it's having a hard time getting oxygen in, and whatever oxygen is left has to go all to your tissues so that way they can move. And just remember, your heart is one big muscle that requires a lot of oxygen. So the less you're breathing at night, the less oxygen you're bringing in, and the more you're affecting your heart's ability to pump and perform normally. You are at a very higher risk of stroke or a heart attack if you have untreated obstructive sleep apnea. And this is because of all the cardiovascular changes that can take place. You can have heart enlargement because the heart has to work very hard during sleep to pump the oxygenated blood around. And we have a lot of patients with AFib. That's another big marker that if you suddenly have an onset of atrial fibrillation and you're like, wow, where did that come out of? A lot of times that's from people with untreated sleep apnea. We see a lot of patients that's a very big comorbidity with their obstructive sleep apnea. Type 2 diabetes, this is a very big one. And as you've been hearing probably with our COVID patients that have been in the hospital, a lot of them suffer from diabetes. A lot of the patients that we have lost or have passed were either extremely obese, had underlying OSA, diabetes, and other comorbidities. The problem with diabetes is that if you don't treat it, you can develop OSA, and you can develop type 2 diabetes because of all that carbon dioxide levels that stay in your blood can lead to insulin resistance. Also, if you have untreated OSA, you can have diabetes can lead you to get OSA, and OSA can lead you to get diabetes. So they're really bad partners in crime. So if you are obese, overweight, we know obesity can cause you to have changes in your blood sugars. So all these things are part of a puzzle that with the sleep apnea, if we could take that piece of the puzzle and fix it, we can get some of these things to regulate. We know that obstructive sleep apnea also increases hemoglobin A1C levels. So we know that that is a big factor. And because of obesity, that plays a part in the diabetes as well. This is brand new, and a lot of people don't know this, but there are new studies that show that dementia and Alzheimer's disease can be directly related back to obstructive sleep apnea. The lack of oxygen, just think about it. I don't know why it occurred to us long ago that this could happen, but you're depriving your body of oxygen all night long. Oxygen levels, if you were wearing an oximeter at night, shows sometimes the oxygen levels are in the 50s, 60s, 70s. It has to be in the 90s for you to be healthy. So this lack of oxygen during the night actually affects the blood flow to the brain, and it can interfere with memory. Studies have found that people have a lower risk of Alzheimer's disease if they use a CPAP, if they've been diagnosed with obstructive sleep apnea. New studies are showing that there are biomarker changes, actual changes in people's chemistry that are associated with Alzheimer's if you have untreated obstructive sleep apnea. So this is a very important thing. Even if a lot of people, they're overweight, the fence seems too high to jump over, but this is a big one. Nobody wants to end up with dementia. It's a very, very unfair disease that you end up losing your loved one twice. Also, studies show that our obstructive sleep apnea patients, they don't get into the deep stages of sleep, which we call delta sleep. That's a very restorative stage. You have less of it as you age to begin with. So if you have untreated obstructive sleep apnea and you're not getting delta sleep, that's where these toxins are released that we now know are associated with Alzheimer's disease. This is new research, so there's more to come on this subject. And this morning, I also read that the good thing is that in the early stages, it is reversible. Believe it or not, if you start using your CPAP machine and you're faithful to it, and you're getting the proper oxygenation to your brain, that you can reverse some of these early onset problems that you see with Alzheimer's or dementia. So there's some other diseases too that are other comorbidities that go along with sleep apnea. Those are the major ones. So now what do you do? So you think you might have AFib and you don't know. Do I have sleep apnea? You don't have a bed partner that tells you snore or watches you stop breathing at night. My first major thing I tell people is go talk to your primary care physician or whatever doctor you trust. Or if your insurance permits you to go directly and talk to a sleep specialist, you can do that as well. Some insurances require you to go to your primary first to be referred to a sleep specialist. You can look up sleep specialist or a sleep lab in any town, in any city in the United States and find some place that you could go talk to somebody. I would get tested for obstructive sleep apnea. The great thing now is that they have home sleep testing. And most patients, unless you have some really bad cardiac issues, most patients are tested at home now. Medicare does recognize this as a valid test. We're able to take the apparatus home, put on the little leads, sleep with it, return it to the sleep lab in the morning. They download all the information and we get a pretty accurate test of whether or not you need to go on CPAP if you do have underlying obstructive sleep apnea. If you get diagnosed with sleep apnea, it's very, very important you stay faithful to your treatment. And the first line of treatment is usually a CPAP or a BiPAP unit. And if you use these, you'll feel better. Now, having said that, I've treated people with sleep apnea for probably over 30 years. And it's a very difficult therapy for a lot of people to get used to. There's about a 50% failure rate. So if you are using a CPAP right now and you're struggling with it, you need to reach out, maybe try a different mask, talk to your physician, maybe they can adjust some pressures. Maybe you need to go on what we call an auto CPAP unit that automatically adjusts whatever pressure you need when you need it and drops to a low pressure when you don't. That's pretty much state of the art how people are ordered on CPAP these days. But try to be faithful to it. It's not an easy therapy, but there are new masks on the market that you could try that hopefully will make it an easier go. With your provider's permission, establish a healthy diet. If you're a diabetic, make sure you reach out to a dietitian, make sure you're eating the proper foods, and with your doctor's permission also, try to get some more exercise. Don't embark on an exercise program if you're not sure if you can, especially if you have cardiac issues. Always check with your physician. And this is a big one: establish and maintain healthy sleep habits and routines. And I've done a webinar before on sleep hygiene. It's a very popular topic. We may do it again. And basically, it's all about treating your bedroom like a bedroom and not like a kitchen where you go and eat, and not like a living room where you go and watch TV, and not a playroom where your children come and play. Your bedroom needs to be a place where you go to sleep, so that way when you cross over the threshold, that's what you think of, and that'll help you to get better sleep. And routines such as staying away from caffeine and alcohol, exercise, all these things late in the evening, which can affect your sleep. A lot of people say to me, yeah, but I have a glass of wine, it helps you fall asleep. The problem with alcohol is, yes, initially it does help you fall asleep, but as it wears off, it'll cause you to have what we call arousals and wake back up. And that's a sleep disturber. And it also makes you have to urinate more frequently during the night, which is also a sleep disturber. So the main thing with this webinar we were trying to cover was, there are things that you should be aware of that you may be suffering from that can lead you to have sleep apnea. And if you know you have sleep apnea, don't treat it. Those are the things that you may have to look forward to as far as health-wise. But if you do suspect you have it and you are interested in having it fixed, so that way you can be more healthy and wake up refreshed in the morning, I would talk to your physician about having a sleep test done, so that way you can know once and for all if you actually have sleep apnea. Well, as always, we thank you for joining us today. Please let us know if you have any future topics in mind for us, anything respiratory wise. Even though it's called the Sleep Well webinar, we do talk about anything that has to do with respiratory and respiratory care. Well, thank you again. You guys have a great weekend, and we'll see you next month.